Welcome to the Passion Fruit Podcast, where we uncover inspiring stories from passionate individuals aiming to educate and ignite your own journey of true passion. Without further ado, let's dive in.
So briefly, my name's Romaana. I've just finished my third year of med school, and I'm also a registered nurse. I qualified from the University of Southampton in 2019, I think it was. So about 4 years ago now. That's been my journey thus far. I finished nursing. I think I worked for about 7 or 8 months solidly, and then went directly into medicine from there.
Oh, how was that? How was nursing for you? Like, was it adult nursing or was it?
Yes, I did adult nursing. I'm not a peds kind of girl at all. I did adult nursing. So I never intended on going down the healthcare route at all. And then I actually started to study law.
Oh, right.
And then I think, and it was about a year into my degree that I had a lot of changes go on in my life. And I really decided to sort of reassess what I was doing and redirect.
Yeah.
And it just ended up going down this route. And by the time I started making inquiries about medicine, I realised that I was too late to take any examinations for that year, which is why I looked at an alternative. And that's why I'm really passionate about this topic, because initially when I started looking into going down the medicine route, I started reading a lot about people doing like a different degree first, kind of like a pre-med. And conventionally, in this unconventional situation, people would do biomedical science, which I did look into. And I was like hell bent on it. I was like, I'll do biomed. Like, cool. It sounds like a cool degree. I'm down to do it. And it was actually my mum who turned around and said, I don't think it's the best idea. I think you should do nursing. At the time, I think I was quite ignorant, and I was like, I'm not going to be a nurse. Like, why would I do that? And now looking back, like I realise, how ignorant that was, because actually it's given me such a good footing, such a fantastic foundation to go into medicine with, that I would say to anybody, and I do say it to anyone who wants to do sort of pre-med before medicine, do nursing. If you don't know what to do and you're not necessarily passionate about anything as such, do nursing, because it will really, really ground you, and it will also there's like other perks to it, but it will also really like establish whether or not you're cut out to work in healthcare, because it really does give you an understanding of what it's all about.
That's okay. You've already opened up a door to so many things here. Okay, so first of all, so you were considering, you did a year of law, is that right?
Yes, in Bristol.
Why did you do law?
Honestly, I want to say there's like some amazing reason. I just watched Suits a little bit too much that summer.
You know what? That's fair enough.
And I was like, this is amazing.
You know what? There's some people out there who watch, I don't know, The Good Doctor or House, and they want to do medicine. So honestly, that's a completely valid reason. But then
I feel much better about it now.
Why did you drop out then? What was it?
I just wasn't passionate about it at all. And I think in general, I'm usually a person that if I fixate on something, I'm very intense. And I just couldn't seem to do that with law. And I just felt like I wasn't really fulfilling my potential.
Yeah.
It didn't give me that fire or that zest for like life or education. And I was like, I don't know if this is what I'm cut out to do. I think Rachel Zane only sold it so much before I reached the point where I was like, do you know what? I don't know if this is for me. That's why I decided to leave that one.
Okay, then that's interesting. That firstly, you said that it didn't give you that zest or that kick in life. And what was that? You could say pivotal moment whilst you were doing law that made you be like, no, this ain't the one for me.
I think I actually had some personal like situations that I was going through at the time. And I think at that point they were so profound, and they had such an impact on my life at that point that I realised that, there was a much bigger picture out there, and I really needed to work out what it is that I wanted. And I remember feeling at that point when I was going through whatever, just extremely overwhelmed, and just like I didn't have anything going on in my life that really made it worth living.
Yeah.
And that's quite deep in itself, but it's true. That's exactly how I felt. And I was like, I really need to think about what I want, and and I know that I'm quite a giving person, and from that perspective, I was like, what it is that, what is it that I want to do in order to give back to society, give back to, the community? What is it that I can do to utilize like that genuine care that I have? And then, I went down the route of, as I said, healthcare, but it really was that pivotal moment where I felt like this is something that I think I'm probably much better suited to.
No, of course.
So,
No, it's quite nice that you've got this. Obviously, you had your personal circumstances, and then you had this moment where you were like, no, this is not for me. And I'm glad you kind of acted quick on it, because I guess you
yeah.
probably don't regret that decision.
Not at all. I remember it was actually like 7 years ago to this year. It was exactly 7 years ago. And I was on holiday in Spain, and I was sat by the pool, and it was actually my mum. I speak about my mum a lot. We're very close, and she knows me very well. And she knew I was going through all this stuff, and she turned around and she said, "You really need to find like a very good focus in your life. And what about medicine?" And I was like, I've never considered that, because I never thought I was a smart person, and I'm not an intellectual individual by any means. I have to work twice as hard to be anywhere near as smart as my peers. But yeah, I think once I had that idea in my head, it was like that split second. For some reason, I ran with it, and I've been running with it for the past 7 years. So it's something stuck, clearly.
Something definitely did stick there. No, I can also resonate with you as well. Like, even my own story of getting into medicine wasn't necessarily the simple route of getting in. There was a lot of hardship, and likewise, I'm not the most super intellectual person. Likewise, I have to work 3, 4, 5 times as hard in order to understand a single lecture. But yeah, med school is tough. That's one thing for sure. Hopefully you realize that by now, that
Absolutely.
it's not easy. Whether someone is smart or not is just a very demanding.
Right. Is it just me, or did the first year really stump you too? Because the first and second year, I was like, this is like pushing treacle up a hill. Like, what is going on?
Honestly, it's like, if you look at the content and isolate it, it's okay. You can somewhat get your head around it. In the grand scheme of things, that first year, what's that thing called? That pestle and mortar? No, what's that?
The pestle and mortar, yeah. Oh my God, yes.
I was basically whatever was in that being ground and crushed. Let's say peppers. So I was like literally turned into dust. So by the end of it, and this is another thing, before I started, I never thought that burnout was real. I thought it was just like, this trend that was lol. No, it was not a trend. It was not.
It's not a trend.
It's
not a hashtag. It's not a trend.
It's not a trend. It was
very real.
It was a real thing, and I remember coming home on the train, because I commute from Sheffield to Lincoln like 1 hour 30 minutes every day, and I was just coming home on the train, and I was like, I could just feel like my eyes building up, and I was like, wait a second, is this burnout? Is it real?
Is it happening?
Is it happening?
Oh my God, this is happening.
I was like, okay, hashtag burnout. But like, I think talking about going back to your initial stage, so you first started off in law, dropped out, and then decided to do, well, it was at that moment medicine, the idea of medicine was introduced, but you didn't do medicine instantly. You went straight on to...
I didn't have that option, because when I started applying, it was too late. I would have had to wait another year. So then I would have had to wait a year, do the admissions test, and then wait another year to actually start. So that was 2 years. And in my head, the thought of sort of working retail for 2 years was just not something that I think I could mentally hack. I was like, it's not for me. I don't have it in me to do that. So, because it was such a large amount of time, that's why I then considered doing a different degree. Had it been 6 months, I would have just, withered my time away. But with, looking back now, I realise that it really was the best thing for me personally.
So this is another interesting thing, because it's definitely like an unconventional, your route is definitely unconventional, but considering how many people do biomed. So if they don't get into medicine first time around, typically it's biomed where people tend to go, and then they go on to medicine. Why not biomed? Because that's really interesting, because like every other 19, 20, 21, 22, 23-year-old out there is probably thinking, okay, if I don't go into medicine, probably do biomed, because that's where everyone else is. What would you say to that?
I would personally, because I have a lot of friends who've done that, who'd gone down that route. And I think, this is something I was discussing with someone the other day. I think we have this problem sometimes where, because something is the done thing, as it were, people tend to go down that route and not really assess other options. And sometimes you need to think outside of the box. If you have a genuine passion for biomedical science, I think that's incredible. Do it. But if you are there from the perspective that you want to get into medicine and you're looking at doing something to get into medicine, or like if you're like me where you need to kill a couple of years, I don't necessarily think it's always the best option. There are alternatives such as nursing. And the reason I say this is because now that we've all graduated from our pre-medical degrees and we're all doing medicine, we're all in, well, most of my friends are in a bit of a different boat to the one that I'm in, because I'm able to work. I'm able to get hands-on experience in hospitals. I'm able to work within a team. I'm a responsible healthcare professional as a nurse in my own right, whereas my friends aren't able to do that. They have their biomedical degrees, but they can't actually really use them unless they take it into further education. And that's led on to a host of problems, which is why I would always advocate that, as I said, unless you've got a genuine passion for it, don't think, oh, this is something to pass the time. As someone who's now completed her degree in nursing and I've been working for a few years, I genuinely feel like, I think I said this to you a little bit earlier, I would do it again this way. And the reason being is, not only did I have that time as a student in clinical practice, in my 3-year degree, we have 1 year that we have to do clinical practice. As placements, you get a real feel for, different, working within different types of healthcare. I had everything from working in a hospice to working on wards to working in the community. But once I started working, I work in A&E. So you really do become, responsible, and then you're expected to work as part of the multidisciplinary team, and that's exactly what I do. But I get paid for it, which has funded my medical degree thus far. So not only hasn't it given me really good clinical insight and knowledge, it's actually helped me financially, like in a way that I couldn't even comprehend, because as I said, nursing there's so multifaceted and there's so many different routes you can go down, that it just opens doors, which is why I'm an advocate.
No, I definitely agree with all that. Going back to the point where you mentioned, as a biomedical scientist, you actually have to go further into education and get that license. I forgot what the actual license is called, but it's not the same as with nursing. And this is another thing. So similarly to you, when I finished my A-levels and stuff, rejected from medicine, didn't know what I was going to do, and I received a biomedical offer. And I didn't think, I was like, yeah, I'm just going to go for that biomedicine offer. Plus, it was unconditional. Plus, it was local to Sheffield. I was like, but honestly, like that wasn't based on my grades. I don't know why I got it, or as an unconditional offer.
Don't put yourself down.
But I think the point to make was that I didn't know anything about biomedicine. I wasn't, and I think at that time later on, my parents allowed me to actually think about it, not just make a prompt decision. And I realized that I don't want to be sat in that lecture hall regretting, because I don't know what the future, holds for me, and what it has for me. And what if I don't end up doing medicine and I'm stuck with that degree and I'm not passionate about it? Then what? But I want to take up that choice where I wouldn't regret, regardless of whatever situation I'm in.
Absolutely, yeah.
So I think I'm glad my parents allowed me to make that decision in terms of not take up biomedicine, such a great offer, unconditional, all that sort of stuff. And then I think after that, I was looking to Bradford Clinical Sciences as another way of getting in. But then I got the offer, and then I was like, you know what, let's reject it, because I don't want to be sat in that room, regretting not having given medicine another chance. And like with people, you give them a second chance. I thought, why not this degree? Because it's a pivotal moment in my life, even though I'm relatively young, and the decisions I make can be a bit haywire. But so I took a gap year, reapplied again, and there was a whole load of stories that went on behind the scenes, and then finally tried to get in, and then I ended up doing a foundation year, and then from foundation year
Amazing.
to the normal program, so 5-year program. So yeah, that was like very briefly what I experienced, and I totally agree with you. Now in hindsight, if I was to do any other degree, it would not be biomedicine. It would definitely wouldn't be biomedicine. And
Really?
and I say that for sure because that's probably based off what my friends have been experiencing as well. It's a very heavy science degree, and I'm someone
Yeah.
who wants to get into the practical side of stuff. And at the time, if
Sure.
in hindsight now, I probably consider paramedical sciences or something. So and that's only because of now of the experiences I have. Back then, I probably wouldn't even thought of that. And I think
Yeah.
there's also external pressures as well, like doing
Oh my
biomedical sciences is just looked upon quite well in the in the community. But if you had like, it's a bit of a weird thing to say, but if a male does nursing and then an Asian male does nursing,
Oh my God, yeah. There's
it,
a huge stigma surrounding it. Do you know what? It's not something we talk about enough. I think it's something that we sort of like hush because it's, initially people would be like, oh yeah, I wouldn't do that. Like, men predominantly would be like, that's a female sort of dominated profession. And now that they are doing it, we don't talk about the fact that there is a stigma, especially in the Asian community. And sometimes even for females, sometimes, even for us females, we also get it where it's like, well, what you could have done medicine, but chose to do nursing instead. And it's a shame because at the end of the day, they're two different professions, as is paramedicine. But I totally understand what you're saying with regards to clinical sciences or, biomedical sciences, because it has got a title that, is something that's upheld more, I think, in society.
no, definitely.
Which is why we, and certainly for me, I'll be completely honest. When I first, considered doing it, I was like, no, I wouldn't be a nurse. Like, no way.
Yeah, like
And now,
how?
yeah, like now I'm like, actually, you had no idea about what it had to offer. But yeah, it's funny you mentioned clinical sciences because one of my best friends, she did clinical sciences, and funny, she actually did it in Bradford. Yeah,
What a coincidence, because I know there was
yeah.
like a transfer program from Bradford Clinical Sciences, and they
Yes,
only had
that's
like
the one.
25 spaces, or it was a very small amount. And then I was just sat there thinking, I've got to work my bum off if I'm going to
Yeah,
get any one of those places and even be
yeah,
transferred. And
yeah,
it was at that moment I was like, what if? Yeah, there's what if I get in, all well and good, but what if I don't? Then I'm stuck with the
yeah,
clinical sciences, and where do I go with that, and all that sort of stuff. So
yeah.
there was a lot of thought that had gone into it, but I'm glad I didn't do it. But not to say that course wasn't good. It definitely was. Hence, I applied. But it was just a case of I I was so hell bent on medicine. I was like, I want to do it. I just don't know how to get there. And also consider this: none of my family, no one in my entire family, are in higher education. Obviously, now as the new
Yeah.
generations are coming, yeah, it's almost a requirement: GCSEs, A levels, and so on and so forth, and go into professions. But I was the first one in medicine, or even to a profession where I'm working within the healthcare, and so that was a big jump. And so it was a lot of like trying to look out for information, find the right information. That's probably why it took so long to even get there, because accessibility of information is not necessarily there. So I don't know if you've like
No, I agree.
faced that as well, but it definitely isn't a equal footage or playing game in terms of trying to get into medicine. And then afterwards, I realized how
100%.
competitive it actually is, and it's definitely probably
It's extremely competitive, and I think the problem is that sometimes, and this is going to be a very unpopular opinion,
no, go for it.
but I think sometimes I feel like there's so much emphasis on academia. And I know that the UCAT is created in a way where it identifies skills that you would need potentially as a doctor. Like especially with, I can't remember which one, the one with the shapes and things where you
Abstract
have
reasoning.
to write with abstract reasoning. So it's say for example, I think I read up on it, and it was talking about how you'll get a patient present with numerous different symptoms, and you need to be able to identify what the main symptoms are for the condition that they're actually suffering from, and not be distracted by additional symptoms that they're suffering from. And that was one way of identifying whether or not you have that skill in abstract reasoning. but I think there's a lot more to it, and there's a lot more to people, and I think personality is a huge part
Yeah,
of a medic's role.
100%.
You know, like, it's so important. And as a nurse, I work with so many doctors, and I will tell you hands down, like, I know which doctors I'm going to be running to when I'm concerned about a patient or when I recognize a deterioration. Like, and there are doctors that I would go for other things, and there's, you know, you categorize them, and a huge part of that does rely on their personality, and also obviously their knowledge and
No,
their
of
clinical
course.
background, etc. But sometimes, you know, having a doctor who's able to calmly assess situations, you know, reassure people, work well with the team, who understands how to read the room is so paramount, and it's just not something you always see in practice.
Yeah, there's a lot of like
Yeah,
I question the UCAT as probably one of the only, and obviously the interview as well, but I question it as a way of assessing someone's ability to actually get into medicine. I agree
yeah,
there should be, you know, a filter, and then you should that filter is, you
yeah,
know, is filtered again via the interview. But let's be
mm,
real, the interview is very, you know, it's an easy process. You're literally
yeah,
acting. Everyone knows what the questions are. They're online, not obviously for
yeah.
exact universities, but it's pretty obvious
You
what.
have a rough
Yeah,
idea.
it's not going to be like, tell me why people fall out of planes and like, it's nothing abstract like that. It's
Yeah,
all about ethics. And I think preparing for that is so easy. And then if you're really good at, you know, acting and you can come across confident, then you've literally sold to that person that, yeah, I'm really good for medicine,
sorted.
even though that
Mm,
individual may not have the right quality or traits. And
for
it's
sure.
not to say that they don't have the right quality or traits, but I definitely do think that there should be something else put into place to allow. Um, have you heard of the MPTS?
No,
So
should I have?
no, well, no, I don't think many
No.
people have heard of it. So it's basically called the medical. It stands for the Medical Tribunal Service, where
Okay.
oh, Medical Practitioners Tribunal Service. Sorry, and basically on there, it's kind of like Santa's naughty list of all doctors, and it's
Okay.
updated every single day. And when you look at it, you'll see how many doctors are, you know, removed from the GMC and for what reasons.
Oh my gosh.
And when you look at that and the frequency of how often it's updated, it just makes you think that are those some of those people potentially in your own medical school as well?
Oh my god. I think I had a friend of mine who went through a process of where he was, I think his gym, it was when he was graduating in his final year, a few things went wrong. And I think some of his peers, you know, we always say, or I always say, that you have to be a particular breed to be a medic. And you find that medical school attracts a very, not necessarily a certain type of person because people are so varied, but certain types of people.
Yep.
And they're some of the craziest people like I've ever come
Oh,
across in
med
my
students
life.
are outright. Some of them are like, yeah, speechless. They
Nuts.
make me speechless.
Literally, some of the things you hear and see, I'm just like, how? But anyway, I think somebody had a grudge and basically put in a complaint. And it was about various different things that he was doing. But to cut a long story short, you know, this person was then questioned and penalised on whether or not he would be fit to practice as a doctor
Oh,
over things that were, you know, things that he could back up or things that he could explain or justify. And I was kind of like, there is that, like what you're saying, where, you know, some of these people could be from a med school, and some of these things are really important to be picked up on. But at the same time, sometimes there's over scrutiny, and I think that the system's just not refined enough to identify where there are problems and how to fix them, as opposed to either letting things go. Because as a nurse, honestly, some of the things, like I wouldn't say on here, but some
no,
of
of
the things
course.
I've witnessed or seen just go completely, like, get like brushed under the carpet, are
I can
shocking.
imagine it is a dark
I'm
place.
just like, there are times I'll be at work and my jaw will literally drop, and I'm like, there is no way, with all the regulation that we have in the UK, there is no way this is gonna get, like, you know, sidetracked, and it does. And then there are other situations where there's just way too much legislation, way too much sort of scrutiny, and you just think this is why people are struggling. And I don't know why there's this culture around doctors, because at the end of the day, I struggle to see, or I don't think I see other professions with that kind of culture. We just seem to have a very, very unhealthy culture in medicine, or, you know, more broadly in healthcare.
Yeah,
So yeah,
yeah, I
I'm not
definitely
entirely
agree with
sure
that.
about the system.
I definitely agree with the idea that there are basically there can be another filter halfway through. Like
I agree.
I think preclinical and then the clinical phase are two different phases, and how you
For
behave
sure.
on clinical placement, there needs to be a filter for that. And I'm not asking to
Yeah.
make us more stressed out and start revising for that. But I think, I don't know where I've heard this, but either in Australia or somewhere in the world, they have a psychometric test almost for every med student that gets in. So they put on actors, real life actors. So as soon as you walk onto campus, you're being assessed. Someone will, there was a case where someone was going to find the place where to have their interview, and they went to reception. The receptionist was deaf, and so they could only do sign language. And that communication between that potential med student and that deaf receptionist, they were assessing that. What was that like? But the med
And that med
student,
student had no
they
idea.
had no idea.
Oh my god! Wow. Okay.
And
That's kind of scary. Oh
that's
god.
scary. But the fact that no one knew that was happening just made it even better. And I think even Sheffield say when they hand out interviews that we are watching you as soon as you walk in. And it's things like that I'm guessing there might be something like that, but I've never heard of it since being at med school that there is something like that. And I wish there was, or there probably is. And if there is, then that should be
Likewise.
questioned.
No, I think, like you said, you can go into these simulated sessions and anyone can act or be a certain way because they know that's what's expected of them. But I think if you're you're taken off guard or in a situation where you don't know you're being assessed, that is a real reflection of what you're like as a person. Not everybody is cut out for medicine, and that's okay.
Yeah.
But the people that do make it through, or the people that do practice as medics, they need to have a certain amount of empathy. They need to be able to have a certain type of personality in order to deal with the problems that we face on a day-to-day. And those kind of tests I think are warranted, because that will really establish whether or not you're the right fit for it.
Yeah, no,
Yeah.
definitely agree to that. And so just moving on slightly, so can you recall maybe a specific moment or event that kind of ignited that passion for helping others? Because I know you said, oh, I like helping people. Was there an event or point at which you were like, you know what, you realized that, or you saw that within you, whether that be multiple moments or like one massive event that happened that allowed you to get into medicine or nursing?
I think for me, I grew up around a parent who was always very giving. So my mum would see, someone on the street who looked like they were struggling, and she would go and speak to them. Or she would want to get involved in feeding the homeless. Or,
Yeah.
there were certain times that she even took people in, under our roof, and they were meant to stay a few days and ended up staying 4 years. So, I grew up around that. And I saw a real beauty in just reaching out and sometimes just giving a person a little bit of time and seeing how much it could really affect them and change their day or even their life going forward, especially with some of the profound things that she did. So I always had that sort of basis and implanted in my brain. And then when I then went on to nursing school, I found that I was really easily able to strike up a really good rapport with, most of the patients that I dealt with. I won't lie and say it was always plain sailing. There were times where it's tricky, to say the least. But, all in all, I know that whatever it is that I grew up witnessing from her, it was instilled in me, and now I like to do the same in my clinical practice. And it's just the smallest things. Like, as I said, I work in A&E, so you're in trauma, and in that setting people are like so sort of shell shocked. They've come in because something has happened, and usually something really bad, and just to have a friendly face and for them to feel like they've got someone who will take a second to make them a cup of tea or talk to them, or like explain a treatment to them nicely rather than just trying to get something done and tick it off a list, I think is really important. And I personally have that to give.
Yeah.
That's not to say that I'm the best nurse or healthcare professional. There's plenty that I don't know, but I would say that's one of my strengths. And for nursing in particular, that's been hugely important.
No, that's really nice to hear that you've, like, even before nursing, you had in your own home a nursing element. You had that, that caregiver. You had that really nurturing, caring element around you, that you were almost influenced by that, and as a result, it's a good thing to have those traits, and obviously you wanted to cultivate that even further. And what better place is there to be, within nursing, or whether it be medicine? And so it's really nice to hear that aspect of it, and it's nice to see that's almost like carried out throughout your life, first from your own parents or your mother, and then onwards into your own career, and then in the future you may potentially pass that down as well, further and further. So it's nice that you've got that continuous element of care, and it's not just based off, it's almost like something that's built within you. It's this nature of yours, which is quite nice as well. So then that also brings me on to what has happened throughout your nursing career, and obviously, I can only imagine you form deep connections with patients and their families. Is there anyone or even a patient who you cared for who left a lasting impression on you, like one that
Oh
you
my god,
vividly remember? And then obviously, you know how how did that experience impact your approach to general care and this caring demeanor that you have?
I know I've had so many in the short time that I've been nursing, but there was one in particular. It was a palliative patient who couldn't really communicate or anything like that. And I remember going to this individual's home and just recognizing that they were just really dehydrated. So I went and got some ice chips and just started feeding it to them, and didn't really think anything of it. And a few days later, they were admitted to the hospice that I was working at the time as a student, and they remembered me. And the rest of the team were really shocked because they were like, this individual he wasn't recalling any memories or able to sort of really understand what was going on around him at all. But in that moment, he recognized me and was so happy and just took my hand and started crying.
Yeah.
And just wouldn't let go. And I just remember, looking at this person and thinking, it was just something so small that I did, but it's almost like they really felt it and they remembered me as a result of it. And even now when I think back, it always makes me feel a little bit emotional, just because I remember how tightly he held onto my hand and didn't want to let go. And it just reinforced that feeling that sometimes when you just look a little bit closer and just go out of your way a little bit more than you need to, like I wasn't necessarily, like I didn't need to do anything in that moment. I was a student, I was just there observing. It goes so far. I've had other situations, but they're quite sensitive, and I don't know if they're appropriate to speak about on this, but there have been a lot of mental health patients as well, especially working in A&E that we come across, and some awful situations they've been in or, sadly put themselves in.
Yeah.
And sort of dealing with them and being there for them in their last moments as well, and just being able to know that they were happy that it was you that was with them in those last moments.
Yeah.
So yeah, as I said, I've had so many, but I always remembered the initial patient that I mentioned, and as I said, there are lots of other sort of mental health patients that I always remember.
No, that's really nice to mention that, and the best bit about it is a very simple thing, and
Yeah.
I think I even so when I was on work experience, like probably 7-8 years ago, I was at a hospice, care home, and it was a dementia care home, and at that time, I was really into magic and card tricks and stuff, and I saw this, elderly woman, and the thing is, okay, put it this way, I didn't know I was at a dementia care home. So asking them to pick a card, select a card, and then remember a card probably wouldn't have
Oh
worked well.
wow.
How I discovered it was a dementia care home was also another funny story as well. But um, as I did that, I did more of a visual trick where I made sponge balls disappear and reappear, and it was just that little that shock on their face and interest and how did you do that? And whilst it wasn't anything clinical, it was just that little moment that I still remember their reaction, their smile, my smile. It was a very warming moment. And then came a point where every day I would be there, and there was this woman who would come down quite late in the morning, and she would just like stroke my hair as if she was like almost my grandmother. And that very that those Asian grandmothers who pat you, and
Oh
to be honest, every
yes.
grandmother really, and they show you that love, and she would kiss me on the forehead and stuff. And came a point where we were just chatting away, and I think half a year later, I just went to hospital for some personal reasons, and I saw her there, and
Oh wow.
I was like,
Okay.
she probably doesn't remember me, probably because I've grown out my beard, but it, it was that moment I was like, ouch. Like, they were once, just patting me and coming downstairs, but now things have slightly changed, and I didn't think too much of that moment, but it was just, it is just stuck with me. Just I didn't think much of it. I
Yeah.
didn't maybe potentially learn too much from it, but it was just that moment that it was very emotionally, um, you know, demanding that whole situation. Even though it's not big, it's
Yeah.
not anything phenomenal that they remembered me or anything like that. It was just almost a realization that time is moving on very very quickly, and to cherish the moments we have. As cliche as that sounds,
100%.
as
But that's
cliche.
why it is so profound, though. It really is that profound because it makes you realize that in that moment it is a big deal. You
Yeah,
know.
I think because obviously I hear it here, there, and almost everywhere, and it's almost like it's just like kind of this norm, this idea of being able to cherish the moments you have. But I think as we've grown older, you probably realize it is a big deal because nothing is permanent except change, and things are constantly moving forward. You're never going to be the same person you are today, and tomorrow you'll be a different person, and so on and so forth. And likewise with other people, and so tomorrow, as dark as it is, but tomorrow is never confirmed as well. That's what it potentially taught me, being at that care home.
Absolutely.
And so almost cherishing the moments that we have today, and, doing good and being good to others. And so I really like your story that you've mentioned there with your initial patient that you mentioned, and kind of going a little bit more personal. So on a personal note, how do you, because I know nursing is demanding and so is medicine. How do you kind of maintain a sense of balance and well-being amongst all this emotional demand of nursing?
For me personally, it is very, very emotionally demanding, especially because I can be quite an emotional
Mm-hmm.
person, especially when it comes to connecting with people. So, going into medicine and having that balance, having that outlet has been really important because it's like a different side of things. I'm studying, so I'm not necessarily always emotionally investing.
Yeah.
So, I really love that paradigm. And in addition to that, I have so many other hobbies
Mm-hmm.
that I've tried to use to all help me on my journey. Like, I teach English, I bake really funky anatomy cakes, I model. So I do all of these different things to sort of keep my mind at ease.
Mm-hmm.
Because I think we've all done it where we've gone on a shift, or if you're anything like me, I will sometimes be crazy and do like 6 shifts in a week. Literally, because I only work during the holidays. And I get to a point where there is burnout. I had that situation last year. It was so embarrassing. I had a really, really tough shift. And with the current problems that we have in the
Mm-hmm.
NHS, which is a huge topic in
Yeah.
itself, basically they're just very short staffed. And my healthcare assistant had to leave because they became unwell, and I was left on my own with X number of patients. And I was in majors and in A&E, so that can be quite heavy in itself. And it was just overwhelming. And I just remember getting into the taxi at the end of the day and like bursting into tears. And the guy looked at me like, "Are you okay? Like, do you need professional help?" And I was like, "No, just take me home." And I've, because it can become way too much sometimes, and that's why, like, since then I put an even bigger emphasis on having all these different hobbies, because if you don't have something to walk away from your job, like at the end of the day, if you don't have something else to sort of channel your energy into, I think it can kind of flip on itself and it becomes
100%.
unhealthy, and then you do more harm than you do good.
No, I definitely agree with that. It's almost like, so you've got, your career as, so kind of like a pillar, and then you've got, your modeling, you've got your baking, and so on and so forth, on all these things, and they're like pillars. So if we knock one down, and whatever you put on top is still going to be there. Let's say we put, I don't know, a slab of marble on top. Even if you remove one pillar, the likelihood of it still standing is highly likely. But let's say we only have nursing or medicine as that pillar, and you remove it, that slab will just fall to the ground and it will just crush you.
Sure.
Which is probably a good time to say that you shouldn't make medicine your entire life, because there are people out there who make their career their entire life, or nursing their entire life. And I think even like sometimes people make family their entire life. But I think that balance is really important. But collectively, all these different things become your
Sure.
life, and that attention should be given to different parts of it. So it's quite nice to hear that you're doing modeling, you're baking, and so on and so forth. So it's quite nice to hear that you have these avenues. And would you say you had these even before nursing, or did you get it as a result of how demanding nursing was?
I had some of them before, and I picked some of them up afterwards. But everything that I've ever tried, like, to dip my toe into and enjoyed, I've tried to maintain so that I can sort of make something of it. I like to capitalize on things as much as possible.
Yeah.
And that, again, this is why I really like that what you base your entire podcast series on, being passionate about something, because, and this is something I was thinking about earlier on today because I knew I was going to speak to you, and it was that one thing I found, especially in my younger years, was that one thing is that people can often misunderstand passion as obsession, and obsession has a very
100%. Okay,
negative
yeah, you've just
connotation.
completely opened up a new door. Sorry, continue.
I don't know if that's a good thing or a bad thing. It's just something that occurred to me. I was driving home from work today, actually. Funny. I actually had. I was at. Well, I wasn't at work. I was in surgery today, and it was amazing. And I was really lucky because the surgeons that I was working with today, like, literally got me involved. So we were suturing, we were cutting, we were like stapling, doing everything, and I loved it. Like, it was incredible. And I remember, like, I was like coming back and I was telling my family about it, and they're all like, "Why do you tell us this stuff?" We, like, especially my sister, she was laughing and she was like, "Do not tell me," because she gets really queasy. And it kind of made me reflect on the fact that just in life in general, when sometimes I came across people who didn't necessarily understand what my passion was, for them it wasn't a passion, it was an obsession, and it was viewed very, very negatively. And I remember feeling very insecure about that, especially when I first started on this journey, because it's all I could think about, talk about, eat, breathe, and just everything was medicine. And then I realized as I got older that actually, like, if you genuinely enjoy something and you put a lot of time and effort into it, provided that you balance it like we've just discussed, you can be as obsessed with it as you want to be. Because at the end of the day, obsession is also passion. So I don't attach a negative connotation to it. Obviously, if it's over something unhealthy, something that's like harming you or harming other people, that's a different thing altogether. But if you have a genuine interest in something and it manifests itself as something that you really do give your all to, I think you should go for it. Just do it.
Yeah.
And never be hindered by other people's opinions of it if it's negative.
No, that is, like, you've just opened up a completely new door. So obviously, that I sent you this little mini form thing right at the start.
Yes.
And that
Yes.
was literally just a gauge on whether it was obsession, whether it was a passion,
Yeah.
and where do you land with all of this. And
Yeah.
the reason why it was on a Likert scale and, 1 to 5, and I'd add up the points. This is going to sound really weird. Add up the points, and according to the data I have, it would fall, like that total number would fall into a certain category, whether you're like
Right.
really passionate, okay, somewhat, and so on, so on and so forth. Obviously, you were like really, really super passionate. So I was like, yep. And
She's
I think
come up high on this scale.
and I think that was really important for me. And obviously, it shows as well, because now that hopefully there'll be a correlation to the views with this as well. And it sounds really like, I don't know, like weird that I'm doing this and all that sort of stuff. But it comes back to the point of obsession and passion are two different things, and people don't realize that. And like you said, it's very toxic. I think with obsession as well, you've got this thing of you are, like you said, living, eating, and breathing it all the time, to the point that you are more likely to be burnt out. And are you doing it for the right reasons? Because obsession it comes from your environment. Passion is different because it comes from within. That even if I was to take medicine away from you, obviously God forbid I do that, but like if medicine wasn't with you right now, you'd still be somewhat passionate about it because it's from within. Like that element of still wanting to care. But for someone who's obsessive, if I take that environment away from them, they wouldn't do much about it, and they would just do whatever. But you've obviously fought from law to nursing, from nursing to medicine, trying to find and get that environment, and so that you can express your passion, which is essentially what you've done. And I really like that you've actually brought that idea up of passion and obsession is very different. And it took me a while to even figure out, some of the people I speak to, are they obsessive or are they passionate? Like, what is it like? And sometimes some people are just easily influenced. Being easily influenced is another thing. Because one of the other questions I asked you was on the form, which was, are you easily influenced by other people?
I think I remember that question. Yeah.
Like, I am not influenced by others' perception of my passion. And I think that's also really important as well, because if you are easily influenced, if that individual was to suddenly disappear out, just suddenly disappear, then would your passion almost go as well? So that was like kind of the thing I was thinking of. And I want to hear, what's your definition of passion? I know it's just put you on the spot there, but what would you take as, what is passion?
Genuinely, passion for me, I think, is whatever it is that you set as a goal or something that you have an interest in, that you genuinely and inherently want more than anything. Like, for me, I find that in medicine, because this is something that is my passion, I in a social setting, I am not the kind of person that's outgoing. I'm not the kind of person that will just come up to people and start talking. It's not something I enjoy doing. I am an introvert. But if you put me into a setting where it's anything medical related, I will automatically find myself going out there, socializing and networking. And the reason I do that, and this is a very specific reason as to, or reason as to why I'm saying this, is because it literally is the definition of passion for me, is that I realize that it's sometimes in medicine, it's not always about what you know, it's who you know. So I will turn from being an introvert to someone who's actually like really outgoing, talking to multiple different people, making connections, contacting people. And I've been doing that for the last 7 years, and it's really gotten me so far. So when I started changing in that regarding in those kind of settings, I started to recognize what passion was to me. And that was where I could see that I would change as a person, and not in a bad way, but I'd discover new sides to myself. And I'd recognize that I was willing to make like sacrifices or just make commitments in a way where I wouldn't do for anything else. And I think that taught me that this is something that I'm really passionate about. This is something that I genuinely want. And I think that goes hand in hand with consistency. If there is something that you genuinely do want and you're passionate about it, I would honestly say that should align with consistency. If it's something that you can do day in and day out on your good days and on your bad days, then that for me is something that you're passionate about.
You know what? I
So,
haven't
yeah.
thought about the consistency element of it because, I think I think the most important bit you said there was even on your bad days, would you still do that passion? Because it's all well and
Yeah.
good if you're feeling good. Yeah, I'll, just take out my camera and start recording. Or that's what I'm passionate about, YouTube and videography and all that sort of stuff. But
Yeah.
I think that idea of even on your bad days, even on your good days, regardless of the situation, or do you have that ability? Do you have that energy to actually pick up whatever it is that you're passionate about and go ahead and progress with that? I think that's
Yeah.
one important thing that you mentioned. And the other important thing I wanted to ask was, as continued on throughout your medical studies, has there been any sort of sacrifices you've made in pursuing this passion, medicine? And what have you
Oh my
learned?
God, absolutely.
What have you learned about yourself through these moments of dedication almost?
I think anyone who goes into this line of work will know that your personal life is something that takes a backseat, or, you know, can take a backseat.
Yeah.
Maybe there are people out there who are really good at, managing both, and I think that's amazing, and I take my hat off to them. It's not something that I'm personally able to manage, in the sense that I've just found that because it is so demanding, especially the way that I personally live my life now, if I'm not doing my job, I'm looking to get involved in research, or doing elective surgeries or whatever it is, it takes up all of my time.
Yeah.
So I really struggle to balance, and I find that you lose so many friends. If you don't have people around you that understand or are on the same journey, they don't get it, and understandably those people don't feel as valued. So I think that's a balance that I'm still finding. It's a journey that I'm still on.
Yeah.
But I think, yeah, in terms of sacrifices, I would definitely say friendships, relationships are one thing that have really had to take a backseat. And at this point in my life, I'm quite happy with that.
Yeah.
That will probably change in time. But for the moment, it's the biggest sacrifice so
No,
far.
I definitely agree with that. I think one thing I didn't realize about medicine was that it takes time away from you, and time from places that you never thought it would be taken away. It's like as soon as you start clinical phase, you're like, like I don't have time for XYZ thing I used to do, and things just suddenly turn, and you've got to keep moving forward. And as you're moving forward, you have to learn to balance, and you have to learn to cope. Like no one's going to stop for you. The career's not going to stop for you. You're going to have to learn on the go. And I think that is probably one of the most difficult things about medicine, that realization that certain things will be taken away from you, but it's a sacrifice for a certain thing that you're trying to achieve. And I think this
Exactly.
is another filter in terms of, if someone really can't do it, they probably would, if someone's finding that difficult, they probably would just essentially just drop
Won't do
out.
it.
But
Yeah.
because you're in a situation where you're passionate about it, that passion is probably one of the maybe only things that was leading you on into medicine, regardless of the situation that you're in, with less time for family and less time for friends and stuff. So I
For
definitely
sure.
think that's a major learning point for anyone who's even considering to do medicine, that time will be taken away from you. I think we're
Yeah.
so fixated on the title, or some people are fixated on the title, being a doctor, practicing, helping patients. I think there's a lot of stuff underneath, like you will have less time for family, less time for friends. Your lifestyle completely changes. How early you wake up in the morning, when you
Oh
go to
my
sleep, your
God.
sleep schedule,
Yeah.
all those things matter to an individual. There might be minor stuff in people's lives, but collectively it'll be a big thing. So
Huge.
so it's definitely something to, I wish I considered it. Not that I would have changed my mind. I probably still would have gone ahead with it, but it was just probably something to consider, because it just meant any actions I now take, I will take with care, because I know this time will suddenly disappear out of my hands. And then there's that element of regret and looking back and being like, oh, I wish I did this, or I wish I had done that, and so on and so forth. So that wishful thinking almost. So I think that's something that I'd definitely consider as well. So
For sure.
so in terms of, so you've went from law, you went to from law to nursing, and then from nursing, do you feel like throughout nursing you were would you continue nursing if you weren't to do medicine?
I did consider it initially. I realised that there were a lot of avenues that I didn't know were open to me initially, like the banding goes up.
Yeah.
So I've actually just I've just been, got landed a band 6 job.
Oh yeah.
So you graduate as a
good.
band 5.
Yeah.
Yeah, and I didn't, really think of going down that route, and it's just kind of fallen into my lap. And I thought, you know what, I think this will be really good for career progression, just in terms of knowledge, because obviously this is not, the job that I will be remaining in the next couple of years. It will change.
Yeah.
But there are so many avenues, and as I said, you get nurse practitioners now who are able to prescribe, able to see patients independently. We have a lot of them in A&E, and their role is very, very similar to that of a doctor. However, I do find that being a doctor in its own right does give you that autonomy from the beginning. And I think that it does also open doors for specific avenues that I want to take for me. Like if you want to work, like as I said, in A&E or in family medicine, for example, you can get very advanced nurses who can sort of work within the nursing remit, but are able to take on those responsibilities. However, if you want to go down the route of surgery or anything like that, then you do need to become a doctor. So for me personally, nursing wouldn't be an option in the long term. That is something that I'm going to keep to the short term.
I know that's really interesting as well, because another thing I was going to ask, and to be honest, every med student thinks about this, is where do they want to go? Where do they want to specialize? And what is it that you want to specialize in your current stage, and why? Like, what influenced you to go down that route?
I absolutely love surgery.
Yeah, I could tell.
And up to about a year, no, 6 months ago, I had it in my head that I was too old. I won't disclose how old I am, because I do stigmatize it in my mind. But I did have it in my head that, you're too old. You're at that point where, you have to consider the fact that if you go down that route, it's going to really affect the rest of your life in a very, very profound way.
Yep.
And then I actually made friends with a lecturer of mine who's a surgeon, and went to attend some of his surgeries. And upon doing so, I started getting involved with them. And I never knew this was an option, but they were like, yeah, you can scrub in, you can get involved. And I was like, okay, cool. So it started off me as the med student in the corner, hoping that I wouldn't de-sterilize anything, as you do. And it turned into something much bigger than that. And I think just getting involved and being able to be so hands-on made me realise that this is my passion. And like I said, I was literally in surgery today. It was a thoracic surgery. We had 3 different cases, and just having the surgeons take the time to show me their techniques. It's the smallest things, how they suture to make things look aesthetically pleasing, or we were doing VATs, so how to use the robotics. All those different things was so interesting to me, and having people around that are willing to give the time and recognize that you have potential is like, it's not that it's validating, because you don't need someone to validate you as such, but sometimes it's just that reassurance that, yeah, I'm really passionate about this, and actually, according to someone who knows this field really well, you have the potential to make it in this field.
No, of course.
That's really important. So for me, it's been a huge motivator, and just like I said before, networking is so important. So by networking and making all of these contacts and having these opportunities open to me, because they've not become open to me through med school,
Yeah.
I've been able to explore what I enjoy rather than waiting for rotations and things, because I think sometimes if you're passionate about something, you really do just have to go out of your way. And
That is a really good point that you've brought up, and it's only just made me reflect as well, that because I'm also passionate about medicine, there are certain things I did in first year that you would end up doing in fourth year, like, being scrubbed in, like just asking them, oh, can I join in? Can I do this? Can I do that? And that doing things that are not necessarily part of your curriculum, and not necessarily, like, if you're passionate, you wouldn't wait around. That's a given. Like, you
100%. Do it.
you would end up finding a way, doing something to make it work. Like, where there is a will, there is a way, and you had that will, and you found that way to actually, get scrubbed in and all the rest. And so I really do think that passion does show through an individual. And I think the more you talk about it, the more it's kind of registering in my head now that, okay, these are the quality and traits of a passionate individual. And it is just something that I definitely resonate with regards to, you know, going out of your way and getting the things done that you do want to get done. So I definitely hats off to you for, you know, actually doing that and showing your passion throughout, you know, medical school.
Appreciate that.
And
Thank you.
the other thing I wanted to say was, like, looking back, so going to nursing, like, did you do the UCAT once? I know it's a very personal question.
I did do the UCAT, yeah.
So
The UCAT wasn't.
yeah,
Yeah.
go on.
No. Carry on.
So my question was, so like you did the UCAT, how did you find it balancing whilst also being a nurse? I'm going to assume that you were a nurse or doing your job at the time whilst also.
No,
No,
I
go.
wasn't. I actually did it in my second year.
Oh, okay.
So, in my second year of nursing, yeah. So I actually did it in my second year of nursing. And it was one of those, I did not score as highly as I wanted to. And I remember just, oh my God, I was absolutely obsessed with Medify. Like, Medify was my Bible or my Quran or whatever you want to call it. That thing I would literally take everywhere. So if I didn't have like some form of a book, I would have it on a tablet or my phone, and I would literally just find any 5 minutes I would be sat there just doing quizzes. Like, it was obsessive. It was not healthy. And I think I put so much emphasis on it, and I was so emotionally, like, I put so much on it that I could have done a lot better. You know, it was fine. The school was not bad. I think I'm trying to remember what I had. This is quite a few years ago now. This is 4 years ago. But it wasn't terrible. It was just that, you know, it was so funny where I'd be doing amazing in my mocks, and then on the day, you know, I just remember feeling like, oh my God, I've not fulfilled my potential at all, and feeling like, you know, I really let myself down. And now with hindsight, I'm like, oh my God, there was a whole plan. There was a whole thing that was going to happen. You just had no idea. You needed to trust the process. That's a very real thing, trust the process. But yeah, I think time management at the time was really important because even though I wasn't working as a nurse, I was on placement.
Yeah.
So we were going into hospital, doing full-time hours. So it was very much, and again, being passionate about something, you will find the time. So sometimes after a 12-hour shift, I would find myself sat there with Medify, literally get into bed and be like there on my laptop. And I have the same traits now. Even now at work, I'll be at work on a 13-hour shift and I'll be on Pass Med. Just like casually, like, do a referral, or do you know what, let me do a cheeky 2 or 3 questions. Like, it's so sad. And sometimes my colleagues just look at me like, what is wrong with you? And I'm
that is a very admirable thing, like just to do a cheeky pass med question. And
literally, like,
if I had you as like in my year and I saw you like, oh, Shuma, I'm just doing a cheeky password question, and you're smiling away, looking at it and just doing it, I'd find that inspiring, and it would just only further inspire me to actually open up my phone and actually open up Passmed and
I'm really glad to
do
hear
it.
it's a good thing and not a bad thing.
But
Because most people are like, there's something wrong with you.
no, there's nothing wrong with you. It's like a very admirable thing. And that, once again, is the quality and trait of a passionate person. You literally are making something that is so tedious and boring, and, you know, people do it out of stress, these past med questions a lot of the time, but you're doing it literally for the sake of, you know, fun. Like, you're
Well,
adding.
I want it to be fun because studying is not the most, you know, I like it. I'm not going to lie. I do enjoy sitting down and studying, but it can get overwhelming, especially like, you know, like after when you're doing it day in and day out, and especially at the end when you've been studying for months just before exams, you are burnt out. And I find that if you get into a habit where you're like, sometimes on it, as I said, like 12, 13-hour shift, I'll only be able to do 3 questions. That is all I'll have time for. But, you know, just taking that time to quickly, like, read something, and then I'm, you know, in a work environment and I'll do something else, it usually consolidates what I've just read in my mind. So even if I don't 100% remember it, something resonates there. And I think it's just that general attitude more than anything of, let me just build my knowledge where I can. It doesn't mean it's going to be perfect. It's just more an attitude and discipline. And the more you do that, the more you find that you will find opportunities to do things in life that you didn't think you'd be able to do. And that's why I try and instill that in myself. Whether or not it's beneficial in, sitting my exams, I don't know. But I do find that it maintains that discipline, and also my interest. So for me, it's something that I enjoy. So I'll just continue to do, really.
No, I really like I find it completely admirable. It's literally like I am so glad that I've got you here, like speaking to you, because you don't realize how happy it's making from the inside, how passionate you are about it. Because I think that's another thing, that who you surround yourself with can make or break how you perceive a certain thing. So if I'm surrounded by people who are always complaining about medicine, I failed this exam, oh, this is so hard, blah blah blah, like I am, whether I like it or not, however hard I try, you will have that element of influence. That there will be that mirrored into your own life. But if you snap out of it and realize that not everyone is like this, there are people who absolutely love it, and if you surround yourself with those people who absolutely love and enjoy, let's say for example medicine, you will find it much easier and be easily more influenced with regards to liking medicine. It's almost like walking into a perfume shop. You're not going to walk out stinky. You're going to walk out smelling really nice, whether it's of oud or whatever it is. Like, you're going to smell really nice. But if you walk into a garbage place, you're going to come out stinking. So,
100%.
and that's not even in
It's the
your
same
control.
thing. Yeah.
And
You have to be disciplined with yourself, with who you
yes,
surround
I
yourself
think
with.
being disciplined and controlling your environment, knowing that you have more control than you actually think you do. I think that's one thing for sure. People are, oh, I can't leave this friend, or I can't, no, you can.
Oh my God, 100%. I don't know if that's an age thing or an experience thing. I don't know if you're as old as I am, but honestly, I get to that point where I'm like, if someone, these kind of things where you can't leave your friend, or you need to do this or whatever it is, recognize a dire situation from something that's just not dire and not important. And there are times where you have to put your foot down, and if people around you don't understand that, you're not surrounded by the right people. It's just that simple.
Yep.
Be honest with yourself and be honest with them.
No, honestly, like, being honest with yourself is probably the most important thing. And if obviously you're not honest with yourself, you're just not doing yourself a favor. You're going to deceive yourself, and it's just there are repercussions of that. Obviously, lying's not good, so lying to yourself is probably even worse. And I think another analogy that I have with regards to environment and surrounding yourself with the right people is, if you get, I don't know, Zamzam water or like pure water, right? If I was to drop urine in there, would you still drink it? Probably not. But then it's just that idea of, surrounding yourself with the right people, and that bad can always turn, so bad people can always turn good people bad.
Yeah.
And in order for a good person to turn a bad person good, that's harder. It's almost like, rotten fruit. Rotten fruit makes other fruit that are ripe and nice rotten, but nice and fresh fruit doesn't necessarily turn rotten fruit into fresh fruit. So I think
Exactly.
it's understanding and acknowledging the fact that your environment and the people who you're surrounded by is so important, and especially in terms of achieving your goals as well. It seems like a very minor thing, it's a very small thing. I'm like, what impact will that individual have? I'm just doing my thing. No, they will have an impact. Their thoughts,
Massively.
the way they behave with you, it can all influence you. And I think that's like probably one of the most important things, especially when it gets to achieving your goals or pursuing your passion. And yeah, so that's what I think with regards to that.
100%. No, you're completely right, 100% right. And if you don't have the discipline to cut, people out who you don't necessarily think are improving you or bettering you, but you do enjoy their company, then make sure that you're enjoying their company within a certain capacity. Don't make it a 24/7 thing. Limit it to a time when okay, this is my leisure time and I'm able to indulge that, rather than compromising your entire degree.
I know 100%. And I think this also comes back to the point of, time management. There's time management, but there's also energy management as well, and
Oh my
not
God.
letting your energy deplete. I think this might be the case, but correct me if I'm wrong. But if you're not good with your time management, then your energy management is awful. And if you automatically fix your time management, this is for leisure time, this is for academic time, then your energy will automatically be fine because you've got a dedicated time for certain things. And I guess this might be more of an experience thing. I'm not entirely sure, but you tell me, what are your thoughts on that?
I think that if you're able to work out when it is that you can study, when it is that you need to work, and when it is that you need to enjoy time off, then like you said, you are able to manage your energy. Essentially, because it's exactly as you said, you then are able to categorize exactly what needs to be allocated where.
Yeah.
If you indulge 24/7, you naturally feel really rubbish about yourself. You naturally feel really crap. And what happens as a result of that is your energy is off.
Yeah.
And then everything is kicked off the balance. And this is something I try to remember on a daily. Like, I have not a set routine as such, I wouldn't say that. But in general, like during term time when I know I'm studying, like I like to start in the morning because I know my energy levels are an optimum. And then I know that my friends are going to wake up at some point and want to hang and chill. And by then I've already done a couple of hours worth of work, or I've gotten what I need to have gotten done, like sorted for the day, so that I can enjoy a little bit of time with them, and then I can go back to studying. And there's no residual guilt, because I find that as a medical student, that is a huge problem. Like, oh, I'm not studying enough, I feel guilty. So the more I'm like, do you know what, let me catch time now when it works for me. I'm a morning person, so I'll do that then, the better. And then my energy is good for the rest of the day, because if I don't do that and then I spend time with friends and chill and don't really do any work, then by the evening I feel really crap. And it's just like this horrible bogging down feeling. And like I said, that manifests as a really bad energy. So that is something that I'm very, very aware of, and I try to manage now.
No,
For sure.
I definitely agree with that. And I think it's almost like being, I wouldn't say selfish, but almost looking at when you work best, what time you work best, and using that. And
Yeah.
once you've done your work, then you obviously have no guilt of however much fun you have. So I think that's definitely an important point that you brought up there. And I think I had one
Bear with me
last thing.
1 second.
No worries. No worries.
So sorry. Yeah.
So basically, there was one other thing that I wanted to ask, which was, looking back on your entire journey, what, so from
Yeah.
going from law to nursing, and then from nursing to medicine, what piece of advice
Yeah.
would you give to your past self, knowing all that you know now about the challenges and rewards that awaited you in nursing and medicine? What advice would you give to your past self with regards to all of this? It can be anything.
I think the advice I would give myself is, it's going to get easier, and you're going to start seeing your efforts really, like, there's a specific expression for this and I can't remember what it is, but basically, like, you start to see the fruit of your labor. I don't know if that's the expression.
The patient
I
fruit
don't
is
know.
sweet.
I feel like it's something like that.
Do
Do you know what I mean?
Yeah. So another one I know is the patient's fruit is sweet.
That's the one.
Yeah.
You start to see that, and I feel like I would definitely say to myself that, starting off as a first year nurse and thinking, oh, I really want to make it as a medic, felt like I knew I wanted it and I knew I was going to see it through, but it felt like a hell of a long road at times. And I think I would tell myself that you just need to keep pushing on. It does get easier. And that, what's really important is to maintain like a happy energy throughout the process. Like, really enjoy the process, because it's not about the ending. And that's something I've really come to understand over the last couple of years, that this process is so dynamic and it's so, there's so much to it and it's so multifaceted that you need to really enjoy it. And I feel like I've really, really put an emphasis on that in my life, where I don't want to lose my 20s thinking, oh, it was a process of becoming a doctor and, now I'm finally there in my 30s. Actually, I want to just enjoy the process so much that I'm like, yeah, my 20s were incredible because I made the most of them doing something that I truly love and I'm passionate about. So, yeah, the journey being memorable is paramount to everything. to me.
I so agree with that. I think people don't realize is yes. So when I was throughout school, I had this idea. Okay, I kind of want to do medicine, and throughout that time, like I'd probably not utilize my time the best in terms of enjoying it. I'd probably stress myself out more than I actually should have. And once I got into medicine, I'm just going to be very honest with you. I don't know what your experience was like when you got in, but the joy of finally getting into medical school lasted probably 1 to 2 days, or probably 3 days. After that, back to almost normal with lectures and going in and out. And I was like, so I stressed myself out for what, 4, 5, 6, 7, 8, 9, 10 years of my life for 3, 4 days of joy almost.
Yeah,
And
literally.
that's not worth it. Obviously, getting in, like all well and good,
It's
but
huge. Yeah.
the actual journey you should enjoy. So right now, there are ups and downs throughout medical school. That's a given. But I should just enjoy this time because I'm never going to be in medical school again. After
No.
this, like after becoming a doctor, I'm not going to go back to medical school. So the time I do have now, enjoy it to the fullest. Do as many things as you possibly can. If you're
Yeah.
passionate about things, go and do it. Like almost the world is your oyster. Like there's nothing stopping you. There's literally nothing stopping you. So I really do
Literally nothing.
think what you mentioned there about the enjoyment and enjoying the journey rather than being so fixated on the goal. Yeah, you have that goal there. That's your destination, but at least enjoy the car journey as you go along. Like, like you do with your family, you play I Spy or My Little Lie, or you look out the window, you chatter away, and by the time, you don't even realize the time and you already reached your destination. So it's kind
Yeah.
of like that. Whereas if you're constantly shouting in the car and arguing and stressing out, that journey can be a really long and awkward journey. And when you get to your destination, it might not feel as rewarding.
Yeah.
And actually, the reward isn't even like the goal. The reward is actually the journey that you had. That's how I
I
see it.
agree. Because that's when you have your, like you said, you work so hard and you get into medical school, and that is a time, however short it was, you're always going to remember how important it was. And that is part of the process, and that's not the end. That's not your goal. That's not your journey. That's not your end. That's not your end game. That is part of the journey. So those are the crucial moments that you need to have, and which you should hold on to, for the days that get really tough. You're like, actually, I had this amazing moment, and that's what pushes me forward. And I always laugh with my friends about this, and I always say to them, when you guys start working, you will understand the reality, especially if you work in the NHS, the reality of what having a job is like and having to work in that environment is like. The fact that you have this time, this sport time to just study and to, enjoy this period of your life, which is so short, make the most of it. Because once you start working, it changes the ball game, and you're not going to have as much freedom as you do now. And it's something I think that we don't talk about enough, and we don't recognize enough because we're so busy sort of focusing on the fact that the degree is so long. We forget that actually it kind of buys us time to really enjoy these years,
100%.
which I think one day we're really, really going to appreciate.
I totally agree with you. And I think looking back at it, like once we become a doctor, we're not going to actually remember the day we got that title of a doctor. It's actually the journey, that entire process of going throughout medical school, first year, second, third, fourth, fifth, and so on and so forth. So I think that entire journey and how you spent that journey is the reward and is what you were actually working towards. But I think some people either realize really late, and then there's
Yeah,
that element of regret, or there are the other people like yourself who have realized that and are enjoying as you go along to the point, this is your reward and it's almost like fulfilling you from within inside. And you just, now you can't wait to become a doctor, but you're also enjoying the time you have now. It's like a win-win.
yeah. I'm kind of like, I kind of already know that, John, one day when that time comes, I'm going to be so happy. But I also know that I'm actually going to be also really simultaneously sad because it's the end of an era. And like you hear people say it when they get to the end, but I feel it from now. And I think that's a huge motivating factor. Like, as ridiculous as this sounds, every single day when I wake up, I'm not like, right, okay, I need to be my best self and all of that. But I'm like, I need to do something that's going to contribute towards my goals. So even if I just listen to one Pathoma video, or, you know, I go to work or whatever it is, there's always something that I'm doing, because it just reminds me that actually, like, your time is not forever. As much as it feels like, oh my God, 5-6 years, whatever it is ages, it kind of like flies. I don't know if you've experienced that. It just
100%.
goes, and you're like, what? Where did the time go?
It's so quick. Like, this is another
Right?
reason, as like looking back onto YouTube and why I started YouTube. I didn't start YouTube because, you know, I like videography and all that stuff. That came later as I did it. I think the main reason was that I wanted to document my journey, because I know everyone's going to leave with a title as a doctor. Everyone's going to leave having done medicine. But what am I going to leave with extra? And I think that extra thing that I wanted was almost an appreciation and that gratefulness as I'm going along. And I thought YouTube was that, you know, that medium that will allow me to be a little bit more grateful. I have, you know, time to think and reflect on the things I've recorded and the things I've captured. I'm more, you know, mindful about it. And I think that is literally why I started YouTube. And as a result, I see so many benefits other than, you know, the Instagram side and speaking to loads of other people. There's so many benefits that came with it, but that was the main reason. But yeah.
It's going to be amazing for you to look back on your videos one day. Like, you're going to look back on them and be like, oh, this is something that I experienced, or this is how I used to think, or this is how I was. I think it's amazing. It really is a memory bank for you.
I know, it literally is. And that point that you've just mentioned there, so for my medical school, what I did was I set up this initiative called the Freshers Welcome Card. So on that first day, when everyone arrives, they get this like nice card which says, you know, Lincoln Medical School on, and it's all embossed with silver and so on and so forth. And there's a little box, and in that box it says, how do you feel now you've started med school? And it's day one, and that excitement, that buzz, that anxiousness, that nervousness is all still there. Everyone captures that moment. But 1 week later, that feeling just suddenly disappears and you'll never feel it again. And almost I've captured everyone's feeling in that moment. And, you know, that constant change. So I think that's another thing that made me realize, I was like, whoa, things are moving fast and they're changing really rapidly, more than we actually think they are.
Thank you for listening in to episode 4 of the Passion Fruit podcast with Medicaro, also known as Shmile.